They said they can see us.
Yeah, that's all I'm saying. We might want to just get started.
Yeah.
And just upload the video later.
Yeah, let's go for it.
All right, so it's 8 o'clock. We have 11 attendees. All right, so thank you everyone for joining us today. Thank you to the panelists for joining us as we talk about this Flint water crisis settlement. As you know, we're 6 years into the water crisis and we have still not seen justice yet. And so we're hoping that through this conversation and through many more, we can get a little bit closer to justice. We can go ahead and start off with introductions, and whoever wants to go first can start.
Okay, well, I guess I'll start, Jasmine. Thank you for having me. I'm Karen Weaver, Dr. Karen Weaver, former mayor of the city of Flint, and I'm glad to be here with you all to continue having this conversation around what's going on with Flint and where is the justice when we talk about the settlement that we're faced with. So thank you for having me.
Thanks.
Hi, Jasmine. This is Pamela Pugh, Dr. Pamela Pugh, the former Chief Public Health Advisor for the City of Flint. And whenever Flint calls, I'm always here and definitely ready to have the conversation about environmental justice, environmental injustice that occurred in the City of Flint, and we see continuing to unfold.
Thank you.
How you doing, Jazz? Thank you for inviting me on. Name is Arthur Woodson, community activist, veteran. I'm glad you invited me to be on today. Ready for the conversation.
Hi, thanks Jazz for having me on here. As she has told everybody, I am a former Flint resident myself. We graduated together, Jasmine and I did. I attended both Tuskegee University and the University of Florida for my master's in horticulture and genetics. So everything agriculture and water related, it falls under my purview. So I'm very invested in Flint as well as my family. My family's from there, and so we would like to just share some information, you know, from all of our points of views in order to get something, a fair, equitable solution for what's been going on, because what's going on needs change, and it needs people to help fix it.
And I'm Jasmine Hall, Flint native from the north side. I think we're going live. All right, so Flint native from the north side. I'm an epidemiologist and I just care about the city. So thank you all for being here. I just wanted to see if we can start this conversation off maybe with Dr. Weaver and Art and Dr. Pugh, really just giving us some history about the water crisis. For anyone who might have, you know, who might not have heard or who might have kind of forgotten, can we just talk a little bit about what this is?
You said for anyone that may not have heard. You know what? I hope they've heard about it by now because it's been going on for far too long. And it was something that was done to us, you know, at the hand of government. And, you know, it's interesting. And I know Art and I were having a conversation about this really not that long ago. When this first, you know, when all of this first started, we were talking about the cost of water. That's what we had started fighting about originally. And I don't even know if people are aware that it was the cost of water because our rates had been raised illegally. And, you know, we were paying 8 times the national average. And it went from cost of water to E. coli and bacteria in the water to to lead. And it just evolved. It didn't stop. It was like a snowball going down a hill, and it evolved into a water crisis. And it was done to us by people that were supposed to protect and serve us, those that had been elected to be our voice and to watch out for us when they switched our water source, you know, from to the Flint River, and switched it because of cost, and they put cost and profit over public health and well-being of a community, and then tried to silence the people for 18 months, telling us that the water was good, and it was steadily getting worse. It was steadily getting worse. You know, that's what happened. It was a man-made disaster by elected officials that didn't think the people or the city of Flint was worth $100 a day for corrosion control. And that's what happened to Flint. And it was a large cover up, but you all jump in because I'll start talking about this and be very angry, and rightfully so, rightfully so.
You know, like Mayor Weaver said, you know, it started off with, you know, the rates. You know, everybody was protesting about the rates. And, you know, we wasn't even on Flint River for a month before we failed the TTHM. And July, you know, 2014, everybody was, you know, raising a fuss about the TTHM. So then August, you had E. coli, you had Legionnaires, and you had TTHM. So now we had three different things, a cocktail in our water, along with other bacteria, pathogens, and carcinogens. So after that, then we find out it's lead. You know, the sad part here is that we allowed Governor Snyder to set the narrative about lead, and along with these ambulance chasers, because they knew that they can get this settlement through quicker, and there was more documentation on lead. And we have a serious issue right now going on, you know, with cancer and everything else, and nobody came in to do anything about it. And, you know, having the emergency managers, I saw where one of the lawyers threatened the city council and said, you know, one of the employees pushed the button. It wasn't Dane Walling that made the decision. It was Rick Snyder and his agents of the state that made the decision to switch us from from Detroit to Flint River. So a lot of people have to understand that it was the emergency manager that switched our water. So, you know, don't allow these lawyers to change or change the story or the narrative, making us think that, you know, an employee of the city of Flint and city council voted to go to Flint River. It was all done by Rick Snyder's command and his agents. So, you know, just make sure that, you know, everybody remember that Rick Snyder and his agents are the ones that put us on Flint River.
Thank you.
Okay, you know I have to say something now. You know I have to say something. They sure didn't speak up for us. They sure didn't say anything when we were fussing and crying about it, I can tell you that. And they sure helped keep it silent, many of them.
Right.
And I remember when at the city council meeting, they were told, don't vote because your vote doesn't matter. That's how they roped us in. They were specifically told, that's Darnell Early. Tell him to do it all by himself. And that they kind of bought into that now. Because I remember, well, anyway, here we are. You know, I can't let that part go by. Come on.
You know, at that meeting, Mayor Weaver, that's when I told Darnell Early that how can he bring you in here and you couldn't even save Saginaw? And I don't trust a person wearing a jerry curl in 2014, you know.
Okay, look.
I mean, I told him this at city council, man. You know, why you switching us over? You know, I mean, I was mad. So
right.
My fault.
I mean, and how do you switch us over? How do you switch over a water source and not test it? How do you do that? I mean, and you know, and you talk about where we are today. Some of the things, and I think this is the outrage, and I do want to hear what Dr. Pugh has to say about this. I want you all to jump in too. I mean, I want to hear you because, you know, we talk about COVID, right? And we talk about the rates being so high and how, you know, we as Blacks are dying more than everybody else. And you look at our numbers in Flint and they're so high. And one of the things that I have been saying is this is another result of poisoned water because we compromised our immune systems by drinking that water all of that time. And so there's another underlying condition that has not even been factored into the equation. And that's why we're saying this settlement stinks. It's a piggy bank settlement because they aren't even thinking about those things. Nobody thought there was going to be a pandemic right after that. And so here we are, Flint people who have been drinking poisoned water, whose immune systems have been compromised, whose physical health has been, damaged. And we're still waiting to see the outcome. And some of these things weren't going to manifest themselves for some time, but you're seeing it play out. And so, I mean, we're in a really peculiar situation because we hadn't gotten through a first public health crisis where we were poisoned. And now here we are in another one. And that's part of my issue with this settlement. You know, when you talk about the human cost.
That's the next question. Go ahead. Yep. What's wrong with this settlement?
I mean, 600 million, and let's stop saying 600 million because it's not, because the attorneys are going to get their part, which let's say 400 million between the 80 to 100,000 people. That is absolutely ridiculous. It is absolutely ridiculous. And when I think about how hard and everything Dr. Pugh was doing for the water crisis, and now you've got this, and then you look at the other things that Art has even talked about as far as these other studies that are going on or need to go on to determine our physical health and well-being. I just think it's absolutely awful.
And it is. You really pointed out something. You said that 80 to 100,000 people who were here, who were exposed, and that's not even including people who went to church, who went to school, college.
Exactly.
Daycares. So there's more than 100,000 people who were exposed to the water crisis. If every one of them joined this claim, people wouldn't get as much as $5,000 if it was split equally. So this is
they wouldn't get that.
It's absolutely is racist. It's unfair, and it's not enough.
And I think one of the questions that was asked, and I think it's a good idea to level set us with where we are in the water crisis. So I don't know if Mayor Weaver or Art or Jasmine, if you want to do that before I jump in.
Oh, I think you're muted, Art.
What was that, Dr. Pugh?
Where are we with this settlement?
Where are we? We stuck on stupid right now. I mean, I'm serious. I mean, the settlement is messed up. And, like what the attorney said for adults, right? If you don't have a blood level test done, blood work done, or if you don't have bone testing done, you fall under property. And property is $1,000 for that property. So if it's 5 people in that house and using that address, 5 people have to divide that $1,000. So now you got to take the attorney fees out of that $1,000. So if it's 5 people in there, which you might end up getting $500 after attorney fees, y'all only get $100. So when you start breaking this down, and how the attorney that I had on Zoom, how he started breaking it down, we are messed over. And what really upsets me is how Corey Stern, and I have to hit on this every time because that guy, I felt the arrogance about him. He said we here in the city of Flint should be more than satisfied because that's more than enough. How do you know what's enough for us? How do you know what I done been through? How do you know that $600 million or $1,000, $500 after attorney fees will help me get over my cousin passing away from this water, my aunt passing away from this water, my friend just passed Sunday from this water because she had multiple myeloma. So how can you tell me that $600 million is enough for me? I can't speak for everybody else. But they made it so complicated that even with the kids, where IEPs normally don't have to have a neuropsych and a pediatrician to sign off on it, now you got to have both of those just for your kid to be able to get some money now. And then, you know, bone lead testing. He said that 2 law firms are monopolizing the doctor that does that. So then they got funny and said, you can bust them, or you can bust them down to Indiana and all this. It's not a joke, my man. We've been going through this for 7 years. And for them to try to minimize how we should feel about $600 million, that's not enough. And for people not to stand up, and for pastors to write a letter and say, hey, accept this. This was our time as a poor community, classism and racism. This was the time for us to stand up and say, you know what? Enough is enough. They didn't care about us when they was poisoning us. Why should we care about them if they go bankrupt? We shouldn't even care. We should have stood up. And $600 million is just not enough.
Well,
And,
you know, if we weren't worth $100 a day, they figure that is enough.
That, talking about we're not the community to go out on a limb for. Absolutely.
Right.
There's a couple of questions. People have said Flint City Council voted to give $20 million for the settlement. What's your thoughts on that? And so that might be a part of what's wrong with the settlement, or if anyone wants to touch on that, feel free to.
Yeah, it's a couple of things wrong with that. One, trying to buy people off. That's wrong in and of itself. Two, as you did touch on, Jasmine, a lot of us, myself included, you know, we had to relocate away from Flint, actually. And so, you know, people are being displaced because of this crisis. Only the people that can leave are able to leave, and people that are still there are still being affected by it. So it's pretty much a slap in the face, because people are currently being affected by this health-wise. It's affecting things generationally. And so you're trying to give $20 million. It's a slap in the face to people that are still there, because you invest more in infrastructure in Flint, or invest more in other channels than you are the actual people, which is what makes the city. So my personal opinion is that's nowhere near enough. And then there's lawyer fees. I've gone through, you know, I've dealt with lawyers in situations of settlements. So there's lawyers fees. Then there's the whole figuring out how to distribute that $20 million. If the entire country is going through this with the stimulus right now, and that is barely affording people to get $600 that are struggling, what is 20 million going to do with all the people that have been in Flint, affected by Flint, and still transitioning through Flint? It literally does not add up.
Yeah.
And that is one of the questions that I have, and not being as caught up as I should be since the hearing with the judge, is being concerned about, once the judge signs off on this, what is going to be the deciding factors for who gets what, based on that information that you get from the doctors for the adults. That's concerning for me. And to everyone's point, Art, to your point, and Mayor Weaver, to your point, I look back at the unfortunate studies of environmental injustices across this country, and I think about a report or a paper that was written by Robert Pugh, and he compartmentalizes looks at environmental justice and injustice, looks at from a procedural, distributive justice, and looks at social justice, but looks at corrective justice across this country. And we know that minorities and people of color, whether it's indigenous people fighting for their land, and it's the Latinos who have had to fight, farm workers who have had to fight, but our people, Black and low income communities, not getting the corrective action that they deserve. And corrective action is about definitely the accountability for those who caused it, but it's about restoration. It's not about providing compensation, giving some sort of money to people, but it's about compensate. It's about restoration and restoring people back to, at least back to where they were, and looking at the funding and as it's broken down. And Mayor Weaver, I saw you, I saw Councilman Mays breaking the dollar amount down. The residents of Flint have every right to be questioning and pushing back on the dollar amount, as well as what will happen once this settlement is agreed upon and it moves forward. Our people are fighting for the crumbs, and that is a huge concern. Mayor Weaver, you brought up the fact that now we're looking at the immune system being compromised, and now we have another pandemic that is going, that cumulative effect that this previous disaster had, and now this pandemic has. And then we also look at the fact that we're going through this crisis now. And to the previous speaker, we also know that people are hurting for money. So, you know, is that part of, you know, the rush to move it through? You know, everybody's not able to think as far down the line and be thinking possibly as well-rounded as they we would like for them to be thinking, and that's about the residents and them being able to have the fight to unify, stay unified, and address whether or not or how they can look for a more just corrective action.
Okay, see.
Oh.
Okay, I'm gonna say this, I'll be real quick, Art, because maybe I'm just more cynical. Maybe I'm cynical too, because you're talking about this rush to push through. This is a great time to rush and push through because all eyes aren't on me. You know, they're on what's going on, rightfully so, with COVID. It's what's going on with the presidency and the transition team. It's been holiday time. And so there's all of these other things going on. And by the time the rest of the world wakes up and finds out what really happened to Flint, it'll be done. It will be done. And so, you know, there's this rush to get it done because the timing is perfect for it to just stay under the radar. I'm so glad that we're having this conversation because it seems to be quiet. You know, every place else, people think we've gotten through Flint. Everything is taken care of. They've gotten this money. Things will be fine. And, you know, we're off into the new world now. And they don't know what's really going on. And so I'm cynical about why this rush is taking place right now. Art, what?
No, I'm good. Hey, just to answer that $20 million for city council. I mean, here's the deal. We had until December the 31st for the insurance, to accept that insurance thing.
Mm-hmm.
Why was the rush? Why did you want to rush this through? Why didn't they allow the insurance carrier to come in front of city council? Why did the lawyers keep lying? Every time they came back, we would hear something totally different from Buzzle and Long and attorney Angela Willard. Why didn't the people, why wasn't we able, here's a question, right? Mayor Neely came on in August and said he negotiated with the insurance carrier in August. He said this, he negotiated the $20 million. He said this. Ms. Fields asked the attorneys, why are we just not getting this paperwork? They said that we just not got it. We didn't negotiate. We didn't do any of this. All this is on recording. The last meeting, Councilwoman Winfrey Carter asked them who settled, who did this. They said we did. So why do you keep on going back and forth with who settled what? Who settled this? And then on top of this, right? This 20 million goes to 80%. 80% of it goes to the kids. 80% of the 20 million, anything that goes into this pot goes to the kids and not the adults. So now after that, right, when Angela Willard said, we want to get the bulk of the people to get in this class action, because down the road, we won't have that many lawsuits to have to defend, because we still can sue. Now, if you have anything, if say for instance, we do a cancer cluster study, we get a cancer cluster study done. They find out that cancer was caused by this water. If you signed up with this lawsuit, you can't go down the road and say, hey, you know what? I want to sue for cancer when they denied you in this in this settlement. You want to stay out of this settlement because you're not going to get a dime. Why do I want to settle for $500? I might as well just go and opt out and wait and see if they're going to do a cancer cluster study or find out anything else. Just like the article read 2 weeks ago, that PFAS, COVID, our immune system, if you have PFAS in your system, is you would catch it quicker because of the PFAS. You have to remember that Lapeer molding has 17,000 parts per trillion of PFAS. Richfield landfill had over 1,500 parts per trillion of PFAS. Bray Road had 1,300 parts per trillion of PFAS. Buick City, they just found that they had 11 million parts per trillion of PFAS. Kent County, they found that they had PFAS. They had a cancer cluster study done within months. Their cancer cluster study is done. They had a biomonitoring done. Everything is done over there. We still trying to get things done here in Flint. So I mean, I would not settle for this lawsuit when I know down the road it's going to be something, better. I just have a feeling it's going to be something better.
And when you talk about, cancer, I think about what Dr. Pugh was saying about people settling for crumbs. So, adults are going to be more likely to get cancer, kidney disease, cardiovascular disease, kids, neurologic disease, lots of behavioral problems, psychological problems. And we look at this distribution, and of course, for kids, 80% goes to kids. I'm not going to even comment on that piece, but when you look within those categories and you look at the youngest kids, because regardless of anything else, these are the kids whose brains were still developing at the time. And we see a grave inequity in this distribution. We have, these percentages of who will get what based on what medical history they have. In the kids under 6, if you had your blood tested or your bone tested, or you had a neuropsychological assessment done by both a pediatrician and a neuropsychologist, then you're in that top category. If you had some of the highest lead levels, and if you're in that top category, you're getting 10 times more than kids who cannot prove they're in that 0.2 versus 2.0x category, 10 times more than kids who don't have that proof. We know if you were in school here, if you lived here, if you went to school here, if you worked here, whatever, you were exposed to the Flint water crisis. And if any group of kids should not have such a disparity, it is the kids in that youngest category, because they will be fighting over crumbs. The kids who had the most access to medical resources will be the kids in that higher category getting 2x, which is, x is if you split that entire category evenly by the number of people who join. So we're seeing people fighting over crumbs. Move over to the adults with this 15%. Again, if the city of Flint was composed, including, people in school and everything, of over 70% adults, is not lining up as far as people having even a little bit to pull from. People are fighting over crumbs. We get to that, what is it, personal? Not property damage category, sorry. I keep wanting to call that personal because they put people in that category. But you get to that category and we're talking about $1,000 capped per household. When you think about the household, who owns these houses? It might not be the people who lived in there. So you might be signing up and getting nothing. I'm not a lawyer, so I'm not going to tell people whether to sign up or not, but we need to make sure we're making noise and making sure the judge know what justice looks like for Flint. So that kind of brings us into this next question about what do we want? Because if we're saying this is not good. If we're asking people to sign this petition at bit.ly/Flint says no, we're saying do better. Do better. What is better?
What's better is more money.
And
What's better? I mean, here's the problem, right? Just like you were saying, you have to understand that a lot of paperwork was manipulated, altered. All right, Genesee County had lost a lot of blood work paperwork for the kids and for the adults. So I heard the judge say, well, you know, when Attorney Cooker was talking about, you know, the bone testing, she said, well, they got paperwork. Well, no, we really don't, because we had a whistleblower who just settled with the county on where they told her to do away with the blood lead testing back in 2016. So those documents are altered or either lost. So a lot of kids, 70% of the kids will not fall under that. Then at the same time, the formula, they had to, that's one of the criterias. Well, a lot of parents didn't, doctors didn't write down that I want you to use formula. So now that's another spot that, you know, they can't get money on. What we need, if y'all so, like the lawyer said, Corey Stern, he was going to sue the city for $500 million. Well, you settled for 600, and if you think that you can get 500 from a city, why didn't you sue and say no to the state and ask them for, like Mayor Weaver said, 1.5 billion? Why did you settle just for 600 measly dollars and say that that's fine? If it's that simple, because suing Flint would be even harder because we had emergency managers. Why didn't you say, I'm gonna sue the state for more than $600 million? Because it was easy for them to say, hey, you know what? The kids got lead, the parents, we don't care about, and you know, we'll just get them some crumbs at this time. I'm not an attorney, but I'm human. I see the people in Flint suffering. And at some point in our lifetime, we have to quit singing Kumbaya songs and stand up and say, you know what, enough is enough. We're tired of people asking us for a vote and they get in there and do something totally different. We're tired of people asking us for our assistance and they get in there and do something totally different. It's time for us, especially here in the city of Flint, our family members have died, our friends have died. It's time for us to take a stand. $500 is nowhere. $500, you spent that much money in gas money waiting in line to get bottled water. What is $500? I can opt out and say, you know what? If I don't get a lawsuit down the road, $500, I can take enough cans back to the store and get $500. All of us need to opt out because it takes away the class action. And then, you know, we might can be able to go back and file another class action. But we need to stand up.
So this 1.5 billion. Go ahead, Niesha.
Oh, okay, yeah. So I didn't know if I was jumping ahead at all with what we were discussing about what some of our personal ideas were that could be involved in this, because money is great. But to level the playing field, there's other areas in which that could be done as well. So some of our action items that we were thinking of and have brainstormed about, some of these came from Dr. Weaver as well. It should be obvious that there should be water testing done, not just annually. It should be a part of this lawsuit as well. If they're able to just give out money to people, they can give money back into the city and making sure that things are constantly being checked on to have accountability. Another item was to replace home fixtures and appliances of those who have had corrosive damage done from the water and the consequences from that, as well as offering free tuition to any public college for students that have been in the area of Flint that can prove that residency, because obviously they live there, obviously they've been affected. And in order to get more people on board that are qualified and able to actually fix this problem, you need to educate the people. There's a lot of people that want to help but don't have the education. There's a lot of people that want to help, but apparently we need credentials in order for our things to be taken seriously and our opinions to be taken seriously. So the least they could do is offer at least some sort of scholarship program incentive out of that, to be able to help people to go to get their education. That's small. Like, we're talking $20 million as though that's something. It's nothing. You can give money to people all day, but it's like that old adage where you can give somebody a fish and they'll eat for a day, but you teach them how to fish and then they can feed themselves for a lifetime. We need to be able to feed our people for a lifetime. This money is a Band-Aid. We've been given money. We've been given assistance, but we need something that will generationally fix Flint as well, because the money in the water is only part of the problem. It's just compounded with what's going on.
Jumping on that college, not only students, but anyone who was here, because a college education could change your life, whether you're 20 or 50.
Exactly.
And that's something the state, like if the state of Michigan is clutching their purse, make structural changes. And I know we're going to get to the healthcare and everything else, but if we're talking about college, make it happen.
Yep.
Structural changes.
And Niesha, you're onto something, because many of the things that we have put in place under the Weaver administration, I don't know if they're still in existence. And by the questions that I receive, it does not sound as if they are. So that is very concerning for me, that you do have all of the supports that were put in place that are now going away, and you're getting this monetary that's money that's going to people that is not enough to address the issue, and definitely not at a time when you have some of the other things that we have put in place. And you know, we always talk about Flint, and there's this unfortunate issue of the media and what has really gone out, and the fact that we've so focused on lead. But when we look at the doubling of special education, IEPs, you know, when we look at the death, when we look at some of the items that Art brought up, that we were finding out just as the Weaver administration was being put out. I'll say put out because we didn't want to leave, and we were still working on some items, and some of them are the very things that you're talking about, Art, is that I was in conversations with ATSDR and the CDC and DHHS about how do we make sure that we not only look to see if the PFAS was actually in the drinking water during that time that residents were drinking the water, but what else was in that water, and what else could be factors that we need to be looking at down the line. We were looking at, like Mayor Weaver said, we had a team from out of Chicago that was making Flint the model as it looked at water rates, because water rates are an issue all over this country, and we know Flint was the epitome, or we were
Epicenter.
the epicenter. And Mayor Weaver had brought in the Conference of Mayors to Flint. And so we were really getting into the nitty gritty. And if you go and you listen to the last State of the City, you'll hear about some of those announcements. So when you look at all of those things that needed to come together to address the drivers of the water crisis, as well as the continuous, the impacts that we will see for years to come, that those things are going away as we're talking about this very small amount of money that will go into households to address these health concerns. That is very concerning to me, quite concerning to me.
Thank you.
Yeah. You know, we be at those communication meetings, and you know, that's one of the main things that I asked DHHS, you know, when are we going to get this cancer study that is, you know, that the water caused, because we know, I mean, every time you turn around, it's a funeral for somebody that had cancer. We are looking at this $600 million, and we're not looking at down the road. We're looking at here and now. This water crisis was generational, at least 3 generations. Why are we putting our kids in a position to where they're going to have to protest? They're going to have to do something to try to get insurance, medical insurance, because of the water that happened back in 2014. Nowhere in this language or this settlement does it say it's covering our kids' kids. Nowhere in there. And that alone, that by itself, that is something that we should be standing up for right now, instead of waiting to see or waiting to hear or waiting for our kids' to have to fight for something that they didn't even cause. And we're not standing up for them right now. So that's something that we should be also looking at, is that this is generational, and
Right.
they should be covered down the road. Money should be set aside right now for the next generation and the generation after that.
Mm-hmm. And if we look at the, just the whole, if we just looked at the stress factor, and we had data that looked at the social, emotional, mental wear and tear on residents as a result of the water crisis. But we know that stress and anxiety in and of itself can go through the womb and impact a child, a infant. We know that it impacts the health and well-being and the immune system of adults. We could just look at that in and of itself, not to mention the deaths due to Legionnaires, the illnesses due to pneumonia and deaths due to pneumonia, and Legionnaires. And like we said, the special education costs that could have wiped out a whole school district. We saw it take its toll there as well. And then I'll say this, because someone raised this issue. Someone called me, and they live in Ann Arbor, and they said, Pam, I worked at Hurley Hospital, and during the time of the water crisis, and my child is having issues now. Is there anything that I can look into? Are there any services or anything that resources for me and my child? And I began to list some of the things that they could look into, but a lot of those things, I don't know if they, like I said, I don't know if they still exist. But at the same time, there are other people in other places who were impacted by the water crisis. So again, when you are looking at how this pot of money will be split up, that definitely is, again, rightfully another concern there.
And we see that expanded, the Medicaid expansion, and similar to the other services, we need to make sure this includes people at all ages, people at all income levels, and we need this type of healthcare. Honestly, we need universal healthcare. We should have had it decades ago, but until we get there as a nation, healthcare needs to follow Flint people wherever they go. You should not be confined to stay in the state of Michigan to receive healthcare. You should not be required to stay in Genesee County or Flint to receive a lot of these services. There's so many areas where we are failing to provide justice. And of course, there is a limit to how much the state of Michigan has. Fair.
But they have more than what they came up with.
Absolutely. They have. Go ahead.
I mean, they've got a lot more than that. I keep saying they brought a piggy bank and they should have opened the safe or the vault. This is ridiculous what they're, valuing our lives at. And the other thing they need to do is stop threatening us. If you don't accept this, then you all will be responsible for these lawsuits that come through. So you want to punish the people that were poisoned by making them pay. We were talking the other day, I said, it's like arresting me for indecent exposure and you stole my clothes.
Mm-hmm.
I mean, come on. Where does that make sense? That the people that were poisoned will be the ones that will end up paying if you don't accept this. They need to stop that. And not only is this an injustice to Flint, this is an injustice to all of these Black and brown communities across this country, because while they're trying to sweep this under the rug and rush this thing through and let it stay under the radar, they need to be shining a spotlight on Flint, because Flint should be a model for water quality and water quality standards and what that looks like. We ought to be a model for infrastructure and how you make things happen in an efficient and effective way. We ought to be a model when you look at what we could be getting with this this registry and tracking health outcomes and what works and what doesn't work, and for how long does it take before things are exposed or come to fruition as far as our physical health and the mental toll it's taking. It could be a model for how you spur economic development in a city that's gone through a crisis and let the people benefit because they owe us. If you want to talk about money, give us some economic opportunity and economic justice in here, because they have their knees on our neck in all of these areas, and they want to give us this little pocketbook, like you said, a pocketbook payment, you know, and it's just wrong. It is wrong, and the amount is based on this whole thing, which is systemic racism. They did this because we're Black. They did this because of class. They don't care. We weren't worth $100 a day, and this payment is reflective of how little they value our lives, and we're supposed to get excited about it.
And what it
And
goes
Mayor,
back,
if I can jump in only, and Nair, I'm gonna go and listen to you all, but I've got our family is doing dinner and they're waiting for me. But I just, you know, I think for me, again, it is quite disheartening because we were setting things up to be a model. And again, if we're eroding those things and then stepping forward with money that's not going to correct this issue at all, then that is beyond concerning. And I will say this too, I think it was Mayor Weaver's opening statements when I was talking about the timing of this. While we're distracted by COVID, you know, we're not only sickened by COVID at a higher rate, but we're all also distracted by COVID. But also, when we look at the political landscape, and I think this is where Mayor Weaver was going, and we do have a lot of friends that are stepping up into some great places, and we are counting on those friends to be there for us. We're counting on them to handle this with urgency. We're counting on them to handle this in a way that we know that Flint residents, just like any other place, deserve to be treated, and they need to be heard. And I'm gonna say this too, because Flint has a fight like nobody else. And I want to hear Flint raise their voice as loud as they can and be asked the questions. Don't be afraid to ask for more. This is not about somebody giving you a payout. This is about corrective justice at this point for an injustice that was done to you by your government. And I just want to thank Jasmine for having us on, and you all know I'm a phone call away.
Can you just tell me who friends are before you leave? I want to be real clear on who
when I talk
friends
about friends, I'm talking about people on the Democratic side.
Well, we'll see how friendly. I just wanted to be sure that I understood, and that's what I thought.
Because I'm gonna be honest. I'll be honest. I mean, I would imagine people don't want to deal with this anymore. They're tired of it, and they definitely don't. And they definitely don't want to deal with it if they're going into, you know, if there's so many other things that they got to deal with. And Flint was supposed to go away a long time ago, but you all have stuck to your fight. And I say, Flint, don't give up now. Continue to fight. And that people can be friends on the other side, but this is something that you need to fight. And there are no permanent, what's that saying? There's no permanent foes, no permanent friends. We're just talking about issues. We're talking about justice here. And it doesn't matter who it is. We have to fight for justice. And this is about the health and well-being of this generation. And as others on this call have said, the generations to come.
And Dr. Pugh, and I tried to catch you before you had to leave. You know, I wanted to talk to you. I know you could have really got in depth on the $9 million that GISD made.
Yeah.
So we had to film just to get a couple of dollars.
That's another show. That's a show.
That was a total injustice. And thank you, Art, and thank you to the Board of Education and to the attorney for Flint and others. And we raised the issue in Lansing. Those of us, I was at a table, and I definitely played my part, did what I was supposed to do. But it's unfortunate that you do have to go to court for justice. And when people say it's unjust, but it's not illegal and we can do it, that's a problem. And we fought back. And your school district, between this water crisis and the what has come out of this water crisis, and then that injustice in that funding formula for special education children, which was driven up in the city schools, city public schools, would have taken this district out. And so, you know, that was another place that Flint came together, united, and fought. When Flint fights, y'all some bad, you know what. So keep the fight and don't give up.
Thank you. Thanks.
Some questions in the comments. We're gonna do a closing message from everyone that's still on the line. We're gonna do a call to action, and then we're gonna take a few questions from the audience on Zoom and on Facebook. So add your questions, and we'll just say our last pieces and our call to action. And I'll start. I just wanted to let the record say this settlement is wrong. It's unjust. It's unfair. It's not enough, and it's not distributed equitably. We need to flatten the differences in categories a little more, and we need to increase it at least threefold. Adding on healthcare, adding on college, adding on actual clean water and water that we trust, because we have replaced pipes and fixtures inside of the homes. As a call to action, I hope everyone on this call, everyone watching on Facebook Live, will start lighting up the hashtags for Flint Water Crisis and for Flint Says No. In addition to that, please sign the petition that sends an email directly to Judge Levy. In this petition is at bit.ly/Flint Says No, all lowercase letters, bit.ly/Flint Says No. This will allow you in one click to let the judge know how you feel. She said it last Monday. She wants to hear how Flint people feel about this settlement, not just our elected officials, not just the biggest voices. She wants to know how you feel. So please sign the petition or email her, call her directly, but connect to that judge, let her know. And for anyone who is out there watching and supporting us as a community, please get this trending, because she's settling this sometime in January. And we really want a better outcome than what is on the table right now.
Yeah, I'll go next. So Jazz, thank you again for hosting this and having us on this panel. As a person that grew up and, you know, was born in Flint and then matriculated out of Flint, it's not just a media attention type of thing. I see that a lot of us that have even just because we've left Flint doesn't mean that we've stopped caring about Flint. And we need to get the same support that it was when it was hit in the media and everybody paid attention to it, the same thing that we need to do now. So my call to action would be like what Jazz was saying with signing the petition. But one of my friends from Alabama on here had asked, what can we do from Alabama to even help? Not only signing the petition, what we spoke about was actually creating an opportunity to bombard the people that are in power with an actual call for a meeting. We know that the meeting was supposed to be sometime in January. We want a date. We want an exact date. We want an exact time for people to actually voice their concerns and their opinions. Whether that goes in the form of this Zoom and webinar and invite these people that we're looking to speak to, whether it goes to compiling a list of testimonials and videos and sending this directly to the judge herself, whether it involves blowing up social media, the same attention that it got the first time, we need to not be scared about the second time. And I guess my last little tidbit here is there are people who've carried the torch and we need to run with it. We have the energy, we have the time. Because of COVID, everybody is at home. There is no excuse for you to not care about your own self. And I know people are tired, but at the end of the day, we need to finish this fight. It's far from over, but we need to go ahead and start and finish it.
Come on, collective work and responsibility.
Indeed.
Did you put in the chat where people can sign the petition?
Yep, somebody in the
Yep.
audience chatted it. Thank you so much.
Oh, okay, good, good.
You want me to go before you, or?
Look, it doesn't matter. I think I've said what I have to say. I would really just echo what you two have already said as far as, you know, the action items, the call to action. And I just want people to remember that Flint wasn't about water and it wasn't about infrastructure. Those were symptoms of the underlying, you know, the root cause, which was and still is systemic racism. And that's why we have to continue this fight. And that's why our voices have to be loud and clear. And they are trying to silence our voices. And we have to keep our story out there. You were asking what people from around the country could do. Help us keep this story out, because Flint doesn't need to go away. Flint needs to stay in the spotlight, because one of the things I always said is, you know, watch and see how we're treated, because it's about more than water and infrastructure. And so we need to keep this spotlight on us so people can see what's going on, because I don't think they're really getting the full breadth of everything that is happening here in Flint. You know, you were saying that we need a better outcome. We deserve a better outcome. You know, we didn't deserve what we got. We didn't deserve to be poisoned. We didn't deserve to have our voices silenced and our democracy taken from us. You know, we didn't deserve any of those things, but what we do deserve is not just cost, but all of those other things, not just finances, I should say, but all of those other things that I talked about earlier, whether it was you know, water, whether it was health, economic opportunity, all of those things are what we deserve and what we should get as a result of what's happened, you know, because of this water crisis. And I'll tell you, the other thing we need is our elected officials to speak up for us. You know, they're there for a reason, and they're supposed to represent the voices of the people. And I haven't heard them speaking up for us. I've heard, you know, Councilman Mays speak up for us. I've heard Jerry Winfrey Carter speaking up, but I haven't heard any other elected officials, whether they were at the state level and state representative, state senator, on up to the state. I haven't heard any of them speaking up for the people, saying this is not enough. And so that's something that should happen as well. You know, their voices shouldn't be silent around this. And we've got to continue to push that agenda forward. And so I'm just happy that you all wanted to do this, really, Niesha, Jasmine. I was really excited, because this should not go away. And one of the things I've said is I'm going to continue to use my voice to talk about Flint and to try and help us get everything that not only do we need, but what we deserve as a result.
Thank you. Thank you.
Man, it's so much. I mean, all of us, all of us able to speak on something different. That's how much is happening here in the city of Flint, and it's sad. I mean, I can go off and say, hey, you know what? They did a cancer cluster study, a registry down in Camp Lejeune for what we had, which was TTHM. And we know that TTHM causes cancer. And we had high levels of TTHM. How is it that the only thing that they are looking at in this settlement is lead? And if you do not qualify under lead, you do not qualify for anything. I cannot, listen, I already have PTSD. And I am suffering right now because it's dark in Flint. I have to stay in the house in Flint. Our kids have never, if they was born in 2014, has never drank water from the tap. They don't even know what it is to drink water from the tap. The parents having to, they have to, you know, man, I mean, it's bad. It's bad. They are mentally stressed out having to get things for their kids, especially if they were affected by this water. And you cannot file for mental disability in this settlement. That is one of the main things that should have been able to, the people here in Flint should have been able to file under, was mental.
Trauma, this is trauma.
I mean, seriously, this is something that we should have been able to file under. Cancer should have been able to file under. I mean, the lawyers came in and saw an easy payday with lead because we we had proven that we were poisoned with lead, so they saw an easy payday. This and here's something that the lawyer said, and we have to find out if it's true or not. If we object, he said, if we object, that means that we are in the settlement. If we object, we are in that settlement. So we got to find out, because I don't want to object and I'm in the settlement by default when I want to opt out. We're better opting out than even objecting. Our opt-out is our objection. I mean, we in a bad situation. We allow elected officials, we allow people who said that the water was safe, we allow people that said the water was safe to lead this fight. I'm not going to say any names, but they know who they are. They were over kids. What I'm saying is we are better off opting out than doing anything else. What's $500, man? What's $500? It's nothing. I got $100,000 for somebody using the N-word. We have kids that done suffered. We have parents that done suffered, and all they giving them is $500. And I got $100,000 in a settlement just for somebody using an N-word. What are we worth? Are we worth standing up? Are we worth fighting? I mean, is it worth fighting? Should we stand up and fight for one time in our life so that we can say to our kids, hey, I fought for you. I can say it to my grandkids, I fought for you. I stood up for you one time. One time in our lifetime, we stood up and fought for our grandkids, their kids. I mean, this is our time to really stand up. So, I mean, I took too long on that one. I'm sorry.
Well, thank you, because that just shows your passion. Dr. Weaver, are you going to say something?
No, you know, I was listening to Art, and one of the things he was talking about made me remember when the attorneys were talking, and they were talking about this is a good amount for them. I think after 4 or 5 times I stopped writing down cost effective, because that was how they kept saying this is the most cost effective. Well, that's what got us into a water crisis. You want it to be cost effective at the risk of us. And here we go with cost effective again. So we're putting profit over the health and well-being of the people. So it just triggered that for me when he was saying those things. I said, that's all they talked about. This is cost effective. This is the most cost effective. No, it would have been cost effective if you gave us $100 a day for corrosion control. That was cost effective. Now you don't want to pay what you need to pay for the services that people need and everything else we've talked about, but you want to talk about cost effective. You should have done cost effective on the front end. You don't do it on the back end. But I'm done.
And Jazz, real quick, the one that she's talking about is the lawyer again that went in the newspaper, and I'm gonna say this: you attack people here in Flint. I'm gonna say something. I don't care how mad we are with one another. You don't come in here and attack our family, period. And they the ones he's the one that said, take what Mayor Weaver says as a grain of salt.
Mm-hmm.
I mean, it doesn't matter if we fight with one another, brothers and sisters. But when you come in and do that, then I have no respect for you, because you are a visitor in our house, and you don't come in telling us who we should and shouldn't listen to. I didn't appreciate that. And that right there was enough disrespect for me not to listen to you, So I had to say that right there.
The one thing that we don't want to listen to is this idea that this is only the tip of the iceberg. This is just the beginning. This is the floor and not the ceiling. We keep hearing this from people who are leading us, and they are talking what they don't know. You can't talk about anything that we will get, because we haven't gotten anything yet. It's been 6 years. We haven't gotten anything. And we are talking about the state of Michigan, the primary suspect in the primary criminal in this whole situation. This is the main defendant here, along with, road professional services, along with McLaren, along with, now, like this is, MDEQ. This is all of them together settling for this. So we talk about this being just the tip of the iceberg when everybody then threw their hat in the ring. So what is that? We have the EPA. They have been clear. They're not trying to be held accountable for this at all. So what is this promise that we're hearing about? Because it's not tangible. We're talking about this settlement right here, right now, with the people who need to pay up, who need to offer this health care, who need to offer this education, who need to provide clean water finally, who need to make sure we have at least $1.5 billion after lawyer fees.
At least.
Like, tip of the iceberg. Go ahead, Niesha.
No, you're good. I know time-wise, you wanted to do some questions and answers as well. So I apologize in advance to anybody if we don't get to all of the questions. We know the hour is growing late. There are some questions here. Where do people go for more primary sources on the settlement, like a copy of the petition, not just solely to sign the petition? So they can read what the petition is speaking about, or is that the only location?
So settlement tax is where you can look up information about it, and then there's a link to the settlement details, I think, on the petition. So if you want to look at that categories thing, it's there. And then I'll also just create a short link, and wherever the video is live streamed to my Facebook page, so I'll make sure it's in the comments so that people can easily click and read for yourself. We're highlighting our ideas, our pieces of this, and it's better for you to read it for yourself.
Yep. Okay, we have another question. Let's see. Contaminated water has to go somewhere, and afterwards it goes down the drain. So who will be responsible for testing the soil and watersheds? Is that a part of the settlement?
No.
Okay.
After the settlement, man. I mean, after the settlement, it's over with. That's how I feel, because, and Mayor Weaver, you can contest to this, that when we went to our primary water source, everybody left. And what they're trying to do is like what someone said earlier. They're trying to get this settlement done so that they can wash their hands and say, you know what, we're done now. This is over with. We done gave you a couple of dollars. Y'all don't have anything else. We settled with you. You signed up. You don't have anything else to complain about. And we're gonna arrest and prosecute a couple of people. And I have a feeling that's gonna work out. But still, they're trying to get past this water crisis. So no, they're not gonna do any testing, because we're still trying to fight for a cancer cluster study that should have been done a long time ago.
Okay. When and where can individuals opt out of the lawsuit settlement?
That hasn't came up yet. The judge is going to give us a date, and she said that if it takes 2 to 3 days to hear from the people, she's going to let us know. So she hasn't given any date or anything like that. I think she said January 21st is when she makes her ruling, January 21st of next year.
And of course, if you reach out to whatever lawyer you might be connected with through your class action lawsuit, they will have that information for you when it becomes available.
Okay. Let's see. We have some other questions. Let's see. The water crisis was a violation of civil rights according to the state of Michigan and the NAACP. What are your thoughts?
Absolutely.
It was a violation of civil rights? Yeah.
Yes,
because
it said according to the state of Michigan.
They're absolutely right. They're absolutely right. And that's what we said, because water is a basic human right. That's what it should be. And that's exactly what they did. They violated our civil rights, and they, like I said, they took our voice, they took our democracy, they did all of those things. And it's sad because we knew that they had violated our civil rights, but one thing that always has to happen is somebody else has to come and justify our reality. We knew brown water wasn't good. We knew that for 18 months, but we had to wait. And I'm not knocking the scientists, because thank God that they did document this for us, but somebody has to come and document our reality. Just like we said, this was based on race and on class. And then Michigan Department of Civil Rights came in and said it was based on systemic racism. I'm like, yeah, we know that. But somebody else always has to come and validate us before our story is, believable and acceptable. So yes, they're absolutely right. That's exactly what it was. It was a violation of our civil rights and our human rights.
And I asked the attorney, why don't we see anything in a lawsuit with racism? And they said that it wasn't just blacks that was poisoned. So they said that the judge kicked it out. But like I told them, it's a majority of a black city. And why did you stop? Why didn't you appeal it? And they said they didn't want to waste their money on fighting that case.
Okay.
I'm sorry.
Crickets. Like I was telling Dr. Weaver the other day, crickets with that one too. Another question is, can you name the 3 insurance companies the city of Flint had since 2014? That wouldn't be in my purview.
I'm not great at
Lake. What is it? Lake. It was Lake. Republic. Lakeside. I think it's Lakeside Agency. Republic.
Lakeside Agency.
Right, and Republic. Republic something. It got past us. Put it like that. We didn't even know. And I asked Mayor Weaver. I said, Mayor Weaver,
right. Where'd that money come from?
Right, where did this insurance company come from?
That's what
the emergency manager put it in place. And didn't nobody know about this? And I guess somebody that knew about it was working with the emergency manager to find because I was at city council meetings, during the water crisis, and Scott, I spoke to Scott Kincaid, and I asked him. Scott Kincaid was on council for what, 20, 30
years.
I asked him the other day, and he said, I never heard of this. So where did it come from?
That's a good question.
And that's, just like I said, why didn't they bring this insurance company before council to be able to ask them any questions?
Right. They said no.
Right. Why did they rush it when we had up until December 31st? The judge told them that. The lawyers told them that. Why were the city and certain council members trying to rush it through, and we had until December 31st and not bring the insurance companies up in front of them to find out what was the policy and how much did the policy pay up to, so we can see if we can get a couple of more millions added on. They didn't even want to do that.
Another question, what entity is forcing children with IEPs to have a pediatric approval for eligibility out of OHI designation? That may be under you, Jazz. I'm not sure.
You say what entity? It's listed in the settlement as something that is just needed. You need to have this medical proof. In theory, this comes from the Neurodevelopmental Center of Excellence, which came about from that lawsuit. Now the overwhelming majority of those referrals are held up. So that proof does not exist.
And the entity is the state. The state is the one supporting the IEP and, have neuro and pediatrician. And the lawyer called the Excellence, Center for Excellence, and they don't even have a pediatrician. So how are the kids gonna get this done? And this is what they told Attorney Cooker, and said that it's a waiting list for like 2 weeks or 2 months. It was 2 something. I don't know what it was.
That's way longer.
It's way longer than that?
The kids are not being seen.
See, and that's a problem. All right, you got bone lead testing, you only have 1 doctor. You have the paperwork that was altered or lost, blood lead testing that was lost. So that knocks you out. Then now you got this neuro and
Neuropsych testing.
neuropsych testing.
But here's my question is, so, but what do you have to compare that to? I may score low on a neuropsych eval, but how do I prove it was as a result of the water if I didn't have a baseline?
Mhm.
Wait, hold on, Mayor Weaver. You on something here? Let me. Can you explain that a little bit more for me? You know.
Well, I'm saying, so I get my kid tested, right? Now, unless I have things to show they were developing normally all of this time, if I have that documentation and then all of a sudden my scores crash, right?
Mhm.
But if I don't have that documentation, how do I know they're not going to say, well, how do I know your kid was going to, they didn't reach their potential because of this? How did I know that this might have been their score anyway? Do you see what I'm saying?
Oh.
If I don't have a baseline, because what they want to do now, just because when you look at head injuries and everything going on with the NFL, they're doing baselines now. So
Right.
they can tell. So then they go back and do the neuropsych testing to see when you get back to your baseline, at least I know you're okay. Or if you don't, I have that comparative data to be able to show you lost some points in here, and points lost in neuropsych development and IQ testing, that, you know, that's determining a whole lot as far as how far you are going to go and what you can do. And so, you know, they're putting up all these things, and it's not like it's a whole bunch of neuropsychologists running around. The tests are expensive. The tests take a long time to do because I did them, so I know. So they're putting these things in place that a lot of us aren't going to have. It doesn't mean some of us, it goes back to what you said in the beginning, Jasmine. Some people will have the blood level testing that was done. Some will have the bone testing that was done. You're going to have some that did get some neuropsychs, but most of us aren't those people.
Mhm.
You're not those people.
And for
So
10 times less, you don't have it. 10
So-
times.
so I want everybody to know too, right? Before we get off, when you see that commercial and it says free testing, it's free right now, but on the back end, they're gonna take their money. They're gonna give the judge an invoice and say, "Hey, we paid for their blood bone testing, which
So in
is
the expenses category,
right," and they're gonna take part of your money. So be prepared when you sign up for that too. It's no such thing as free lunches. So I just want you to know that famous days that you ate at the church when they came into town, you paying for that too. Everything that they done, you are paying for that. So I just wanted y'all to know that, people.
Yeah, and then the last question that we have that we're going to do is, let's see, I'm still confused how the city is being made to pay, but the municipality is the people. With the 20 million that comes from the insurance company, what is the city's deductible, and isn't the policy paid for with taxpayer dollars? And that's our final question.
You know, here's the tripped out part, right? They went all the way up to the Supreme Court and found that Governor Snyder, Andy Dillon, EPA, Dane Wyatt, and all the rest of them was not immune. They cannot use governmental immunity. They fought all the way up into the Supreme Court. Why didn't Butzel and Long say, hey, you know what? We had emergency managers. I want the state to pay our part. If not, we're going to fight you. They did not even budge. They said, we looked at it and we felt like we didn't want to go and fight and waste dollars. Why didn't you even attempt to try to fight them? The reason why is because people want things to go away for some favors down the road. And I'm just going to be totally honest. That's how politics work. And they look out for each other, man. And I'm just saying, I mean, I'm just being real. And Governor Whitmer wants this to go away. She does not want this on her record. And if things got to fighting right now and we really got to fighting and bucking, you know, she would probably say, hey, you know what, let's hurry up and give them what they're asking for so this can go away. if we start raising our voices, because closed mouths don't get fed.
Not even when
So-
you deserve it.
Huh?
Not even when you deserve it. Closed mouths don't get fed, not even when you deserve it.
Okay.
Yep. And so those that concludes the questions, because I was looking at Facebook Live too, and there weren't any direct questions, just a lot of comments, you know, and people expressing feelings. So
Thank you to the panelists, everyone who joined, using your voices. Thank you so much. Niesha, you all the way.
thanks for the invite.
Looking out for-
Where is Niesha? Where
I
are
am
you?
in Alabama. I'm commissioning into the Air Force in 2 months.
Okay.
So.
Okay, you're in L. Okay.
You're in Montgomery. You're in
Yes,
Montgomery,
sir.
Alabama.
Yes, sir.
What is it, McFadden Air Force Base?
Maxwell.
Yeah, Maxwell Air Force Base.
You got it.
Okay.
So you've been going over to the roads then.
Yes, sir.
Yeah.
Well, thanks, Jazz, for inviting me on this as well.
Thank you so much.
Yeah. Thank you. We can't stop. This conversation needs to continue. Because we are trying to be silenced, and we can't let them do that, and we can't let them get away with it. And Flint deserves more. We're worth much more. I think this conversation needs to continue and continue and continue. And what you brought up earlier, Art, about the money and going to the ISD, though we need to be having these conversations because people need to know what's going on in Flint, what's being done to Flint, and what's been done to Flint for years and years and years. You might as well say we've been raped for years and years and years. And we want our clothes back, you know, and we're not going to stop fighting, and we're not going to stop fussing, and we're going to continue to be a voice and a force. And I thank you for having me, and thank you all for just, helping us keep this torch going, because we've got to, because we're worth it. We're worth it.
I thank you all, man, for allowing me to be here.
Of course.
It's not normal. I mean, it's not, every day that somebody invite me to be on a panel. I thank God.
And I'd be remiss if I didn't give a shout out to Black Millennials for Flint for creating the petition.
Yes, thank you. Black Millennials for Flint.
Absolutely. Tomorrow at 5:30 on the Facebook page, I'm one of the members of Black Millennials for Flint, and we'll be having another live stream talking about this same thing with Dr. Bellamy of our Black Party, just trying to help get this word out. And we're going to continue, us with different members of the Flint community, with whoever will listen, in the spirit of Ujima. This is our collective work, our collective responsibility, because our neighbors' problems are our problems, especially when it comes to lead poisoning. So lead poisoning and other water-related issues. Mess that up.
I was going to say something.
You got to jump down the throat.
You see me look up?
Right. It's getting late.
Yep.
Again, thank you so much for being here. And we will make sure that this video is on Facebook Live, and I'll try to get it on YouTube as well.
All right.
Okay.
All right.
Thank you, guys.
Everybody, thank you.
Okay.
Happy New Year.
Good.
Happy New
Yeah,
Year.
Happy New Year. Be safe. Bye-bye.